the chase, what we're doing is we're uploading it to the store. We're charging $1 for each download, but we're donating all proceeds to the Pancreatic Action Network.
So, I mean, we can kind of swap around. Just we got kind of do some filling.
Right, but it's very simple. It's basically the front end. Let's select. We'll just select diabetes again, just to be consistent. Gender was female or male. Birthday.
Channeling myself.
Birthday, 1/2/49, January 2nd, 1949. And postal code again is 10025. And 5 miles. And then again, type 2, 30 on the BMI. Yes, takes insulin. No, it's not required dialysis. And the A1C is 9%. And when you fill out all this information, in the exact same fashion, you have some real-time results, and then you'll see the exact same study come up. You'll see a summary of this information, same content, again, laid out in a very simple iPhone-friendly form. And then if the patient actually wants to engage the clinical research coordinator on the back end of a particular clinical research site, then we will direct them to our web application. So that's basically our iPhone app, very, very simple. But again, from a marketing angle, we really want to use this as an opportunity, and a press release will be coming out imminently, that again, every single dollar that we get from this download, we're donating. We're a bootstrap startup, so we could use that money, but we made a concerted effort to really, in recognition especially of Steve Jobs and what he's created. I mean, he's changing people's lives over here, and we really wanted to recognize his genius and his vision and say, look, you've been battling a really tough disease. Clinical trials for pancreatic islet cell carcinoma need to be done. There is no cure for it, obviously. Pancreatic cancer and adenocarcinoma is a devastating disease. If there's one disease out there that would really benefit from increased participation in clinical trials, it would certainly be the adenocarcinoma portion of pancreatic. So again, we're donating all proceeds to the Pancreatic Action Network. And that's it.
Jump into the questions, and this is more of a competitive question.
Yes.
So Trilex does some Google Health integration. Are you guys heading that route?
Yeah, absolutely. Trilex is a competitor to us, and we are plugging into the Google Health API as well as the Microsoft Health API as well.
So along those lines, might it be possible if somebody had a PHR and wanted, for example, more of an interpretation of this very high-end clinical description, that they could send that to their clinician?
Yeah, absolutely. I mean, one of the things, we're sensitive to that doctor-patient relationship. We certainly don't want to be, another Dr. Google and subvert that relationship. So in the next version of our website, we're going to have very easy, one-page printout where the doctor, where the patient can take that one page, not reads, back to their physician and say, look, I found this interesting study. They're asking me about my hemoglobin A1C. I'm not sure what that is. Can you help me out with that?
But they should be able to do that theoretically online, right?
Theoretically, for the enlightened patients who are on, Hello Health and who have their data on Google Health and Microsoft Health, but for a lot of patients, it's still, unfortunately, paper.
Two comments. One, do you talk at all, or how do you address HIPAA compliance and protecting patient information?
Absolutely.
And the second piece is the HIV community has, of course, been very committed to clinical trials from the very beginning. And I think that to the extent that you have that population's clinical trials in it and you got it out to the community, I think there would be interest and real adoption.
Absolutely, yeah. The first question about HIPAA, privacy issues are our number one concern. And in fact, we're building, and we have built tools where everything is opt-in. It's very clear to the user on the front end, that is the patient or their family member, to say everything that you're doing here is on an opt-in basis. But further to that, once we've built this back-end tool, which is in the midst of being built now, through our JL and I's experience at a previous company called Gerson Lerman Group, we're actually building tools where patients can titrate up or titrate down. That is to say, personalize and customize their privacy settings, right? Now, of course, everything's opt-in, and from that standpoint, it is HIPAA compliant. But we want to take it a step further. We want to say, at the point of contact with a clinical research coordinator, you're going to be anonymous up until you, the patient, give the approval to Healogica to say, okay, this is my name, this is my email address, and this is my phone number. And that's something that we're very careful about, and we learned a lot and gained a lot of experience at a company called Gerson Lerman Group. But yeah, the HIV community, absolutely, and we're very keen in working with folks like IAV in particular to, especially the HIV vaccine has been a vexing issue, and I think clinical trial participation in something like that would go a long way.
I had a question here, marketing question. I'm assuming your customers / clients are on the clinical side?
Yeah.
And it's free for the people with conditions?
Absolutely.
How big is that market? And what is your revenue strategy?
Sure. So,
I'm going to guess at both.
Yeah.
The first one.
So the clinical trials industry, in terms of number of patients that participated in a clinical trial in the United States alone, this is U.S. data, in the end of 2007 was just over 4 million patients. In terms of the industry, it's about a $50 billion industry as it pertains to that food chain that I described, from the sponsor to the CRO to the patient recruitment agencies and the SMOs. It's a $50 billion industry just spent on the mechanics of clinical trials. Now, obviously, R&D, generally speaking, is $100 billion. But when it comes to clinical trials, the operations around that is $50 billion. I think to your specific question about advertising and recruitment, it's, there's no real stated numbers, but our educated back-end guess is about 20 to 25% of that. So we're talking about anywhere from on the low end, single-digit billions, to on the high end, double-digit billions are spent on patient recruitment in all aspects. Offline media, traditional media, to online subscriptions and recruitment tools as well.
And you're going to share in the cost savings, or?
Yeah. So our business model is it's a lead generation business model where we would charge the clinical research centers for each pre-qualified patient candidate that we refer to their center. In terms of how we get those patients, again, we're very keen on doing revenue share deals with content partners, with social networks, with blogs, with anybody who is an aggregator of consumers and patients. And again, it's a lead generation model.
One more?
What's the funding status?
We closed an angel round in April of this year. Most of what you see here was actually self-funded by JL and I last year when we started the company. And then we closed a round in April of this year, closed $750,000 from 35 individuals. And that'll give us about, from now, about a 12-month runway. And then we're hoping to obviously prove concepts in terms of traffic, the asset, and revenue.
How do you manage 35 angels?
Coffee, dinner.
There's a lot of drinks.
We have a busy social calendar.
A lot of phone calls. Actually, they're actually really great. A lot of them, we actually bother them more than they bother us. In fact, one of them has been quoted as saying, you guys over-communicate. So we're bothering them more than they bother us because we're always pinging. They're a great group of angels and a lot of experience on the team. So we ping them all the time, just getting